Social isolation in older men, a guide to supporting those during COVID-19. What is social isolation? Aged and Community Services Australia describes it as being the state of having minimal contact or relations with others, whether it be deliberate or unwanted. Older people are more inclined to suffer negative outcomes and possibly death if they contract COVID-19. Therefore, it is imperative for the elderly to self-isolate during the pandemic as per the Australian Government guidelines. Before COVID-19 and lockdown restrictions, 13% of over 65s experienced loneliness and 8% were recorded as socially isolated. Ken Wyatt, the Aged Care Minister, explained with those in aged care facilities, up to 40% seem to never get visitors. These numbers have only increased due to lockdown restrictions. Social isolation is very detrimental to an older person's health, with it significantly increasing a person's risk of premature death from all causes. Social networks, community participation, and the maintaining of physical activity have all subsequently declined due to the restrictions enforced. Therefore, any level of social participation has been negatively impacted, which all are vital contributors to the improvement of physical and mental health. Due to the ongoing restrictions, COVID-19 has had a negative impact on the elderly's self-governance and social isolation. Tobacco smoking is a leading risk factor for the burden of disease amongst men aged 65 to 84, with older people found to smoke more than younger age groups. Research found that those living in regional areas were 19% less likely to cut back during the lockdown than those in metropolitan areas. Older men are more likely to participate in the consumption of alcohol. Furthermore, men aged 70 and over continue to be the most likely to drink daily, with 17% indicating an increase in their alcohol consumption during lockdown. The increase of tobacco use and alcohol consumption can lead to many long-term problems, such as a decrease in mental health, an increase in suicide ideation, increase in developing diabetes, weight gain, and an increased chance of developing cancer. Due to the closure of gyms and recreational centres, older people have shown an increase in sedentary behaviour. Research found that older men indicated that their levels of physical activity decreased during lockdown. Older men further indicated that their consumption of dairy and discretionary food increased during the lockdown period. The lack of healthy eating and physical activity coincide with each other to increase the chances of being overweight or obese. The CDC found that being overweight or obese could lead to developing cardiovascular disease, type 2 diabetes, or hypertension. During lockdowns, older men revealed that they were either delaying medical treatment due to fear of contracting COVID-19 or felt as if their medical condition was not serious enough. This delay puts their overall health in jeopardy. Nowadays, almost everything is digital, from shopping to doctor's appointments to keeping in contact with family. However, this excludes those with low digital literacy being able to access online services. Approximately 34% of Australians who are aged over 50 have low digital literacy. Although these are staggering statistics which divide our nation, research shows that 63% of older adults use new technologies during the lockdown period. One way a primary healthcare nurse can support an older man is highlighting the importance of communication. There is a lot of stigma in Australia, especially in regional towns, of men having to be strong and macho. This toxic ideology is detrimental to their well-being and further increases their chances of falling into social isolation. There are many organisations such as Lifeline, Headspace and Health Direct which have multiple services available. By developing a mental health care plan, this can also help increase health outcomes. These plans help explore the different treatments and professionals that are also available. A primary healthcare nurse can improve health outcomes for older men by looking at large risk factors that have increased during the pandemic. As stated previously, tobacco smoking has increased during lockdown. Smokers are twice as likely to have high levels of psychological distress than non-smokers. A care plan can be enacted to reduce tobacco smoking. Care plans use small, achievable goals in order to achieve a larger goal. The patient will be less likely to feel overwhelmed and fall back into bad old habits. Overall, social isolation is a determinant of health which negatively impacts our older population. Unfortunately, this has been exacerbated during COVID-19, leading to further health problems, an increase in risk-taking behaviour and early morbidities. This is a very important issue that we need to combat by being there to listen and provide support. Thank you for listening.